Good afternoon, and thank you all for being here today. I do hope that everyone had a safe and relaxing Thanksgiving that didn't look like previous Thanksgivings, and safe being the operative word there. I am extremely honored to be joined today by Admiral Brett Giroir, the Assistant Secretary for the U.S. Department of Health and Human Services. And for those of you who don't know, we'll welcome him home because he is a Louisiana native from Marrero, a Jesuit high school graduate. And it's always great, I should say, to welcome a fellow Louisianan home for the day. But more importantly than being a Louisiana native, he's just been a tremendous partner for the state of Louisiana. And of course, he's working on behalf of the entire country. But as the testings are for this pandemic in the effort by the United States, I will tell you, he's just been working nonstop. And I've enjoyed knowing him and working with him. And of course, we've got a long ways to go, and you're going to be hearing from him in just a little bit. He's got some important information to share with you, and he'll also take some questions from you once he's up here. One of the things that I was able to brief him on and take some satisfaction in, quite frankly, is that Louisiana, even with the hurricanes and so forth, we have been able to sustain a high level of testing for COVID-19. And of course, he's aware of that because he looks at the numbers in every state every day. And to a very large degree, those numbers are made possible by the work that he has been doing. Testing is critically important. It is the single most important tool for gauging the level of spread. So you want to know what the positivity is. You want to have that information available as soon as possible after the test result is known, so that you can do your contact tracing, and really almost all the decisions that are made in handling the pandemic result from the testing that you do. And so his work has been critically important for our country. Since the start of the pandemic, we have administered nearly 3.6 million tests throughout the state of Louisiana. We reported 670,000 test results in the month of November. Now, you may recall a couple of times we had some backlogs, and those test results get assigned back to the date of test collection. But we actually reported 670,000 test results in November. More than 287,000 of our total tests have been administered by the Louisiana National Guard, and they too have been doing incredible work under the leadership of the Adjutant General, Keith Waddell. Which is why on Monday, with a call with the White House Coronavirus Task Force, I was able to speak to the Vice President and ask that the Title 32 status that we currently have in Louisiana with the National Guard, where 75% of their costs are being picked up by the federal government, that continues so that we can continue with all these testing efforts that are currently underway, but also we know that they're going to be instrumental once we get into the vaccination program, which we have every expectation is going to start in a couple of weeks. It is very important for everyone to understand that testing remains very relevant. In fact, it's as important today, probably more important today than ever, because we're in our third surge here in the state and around the country. And quite frankly, it has the potential to be much worse than either of the first two surges. And again, testing informs everything that you do in response to the pandemic. So as we look forward to the vaccine, we got to continue to block and tackle, if you will. That's the testing, and I think that's why Admiral Giroir is here today meeting with us. And even after we get everybody vaccinated who wants to be vaccinated in the country and in the state, and I pray that happens sometime in the May-June timeframe, testing is still going to be with us because COVID-19 is still going to be with us, even if we begin to put the pandemic in the rearview mirror. The CDC recently reported the estimated COVID seroprevalence among states, and that's a fancy word that I believe means the percentage of people that have had COVID. And Louisiana is approaching 10%. You can see from our daily reporting and the Johns Hopkins data that just with confirmed positive results, we're getting close to 5% of our state's population. And the estimate has been that 50% of people with COVID are asymptomatic, and they typically don't get tested. So we're getting to that 10% range in Louisiana right now, and that's a lot of people. But it's nowhere near enough to have herd immunity, which is multiple times that 10%. And if you look at the death total that we've been reporting, you know that we don't want to get to herd immunity just by people contracting the disease like it's happened over the last 9 or 10 months. You would much rather get to herd immunity through the vaccination program, and that's what we intend to do. I will tell you that, and this should not come as a surprise to anybody, over the last few weeks, the numbers in Louisiana have not been encouraging. They are all trending in the wrong direction, whether it's positivity, cases, hospitalizations, and most recently, deaths, which is why we went back to a modified phase 2 order just before Thanksgiving. Quite frankly, we just have to create the ability in spaces where people can space out and do the physical distancing that is required, and we need people to mask. And if those two things are done by a much larger percentage of people in Louisiana, we're going to be successful. Remember, we have flattened the curve twice before. We're going to do it again. And we're not trying to be overly restrictive, but we do need people to physically distance and to mask. That is how transmission gets reduced, and we can be successful. Nationwide, hospitalizations of COVID patients has reached a record high of around 96,000 as of Monday evening. COVID deaths have now surpassed 270,000. In fact, November saw the most coronavirus fatalities in the U.S. since the month of May. Louisiana is increasingly looking like its neighbors. Today we reported 3,604 new COVID cases, bringing the total to 241,335. Very sadly, we reported an additional 46 COVID deaths today, bringing the total number of deaths to 6,501 in the state since the start of the pandemic. This is the highest daily number of deaths reported since September the 6th. 72% of these individuals did die in the past week. So it's sort of easy sometimes to get lost in the numbers, but we need to always pause and remember that these are our brothers and sisters. These are fellow Louisianans that we're talking about. They're somebody's brother or sister or mother, father, grandfather. These are our loved ones, our neighbors, our coworkers. Hospitalizations per capita for the state are increasing over the last 4 days as well. I can tell you the number we reported today is 1,288. Now that number is always 24 hours old. But what I can tell you is that is more than, in the month of November, we doubled the number of folks who were in the hospital in Louisiana with COVID-19. We started the month with just under 600. We ended up with well over 1,200. And it's really the last couple of weeks where the trajectory has been extremely concerning. And if we don't get off of that trajectory relatively soon, we're going to be in dire trouble when it comes to having the capacity to render life-saving care in our hospitals, not just for our COVID patients, but our non-COVID patients as well. And which is why, if you go back to just before Thanksgiving, I moved us back to a modified phase 2 to try to preserve that capacity in the hospitals, but also to keep our schools open. We're also seeing an increased trend in the number of outbreaks reported recently. In the first 3 weeks of October, the average number of outbreaks reported weekly was about 10, with an average of 53 associated cases. As of November the 24th, it was 18 outbreaks reported over 3 days. And now I'm very concerned about Thanksgiving because despite all of the information coming from the White House Coronavirus Task Force and all of its members and out of the state of Louisiana, I have to believe that there were individuals who traveled when they shouldn't have, and that there were too many folks outside of their immediate households getting together for extended periods of time without distancing and masking. I pray that I'm wrong. obviously, but what would be the worst case scenario is to have this current surge and then have superimposed on that another surge due to Thanksgiving. And typically it takes 10 days to 14 days after an event like Thanksgiving to see those numbers come in. So we're going to be a bit anxious as we move forward. Louisiana certainly has entered a new and dangerous third surge of COVID-19 infections, similar to the wave of COVID-19 cases that are being seen across the country. It obviously poses a severe threat to the healthcare system. We don't want, at the state level, to do what we did early on in the first surge, and that was discontinue non-emergency medical and surgical procedures. Now, we have had a major hospital in Louisiana, in St. Tammany Parish, that has decided, in order to preserve capacity there, that they were going to stop doing non-emergency surgical or medical procedures that would require hospitalization to keep those beds open. And certainly they have the flexibility to do that. We're hoping not to have to do that statewide, but we do know that hospitals are having to make these decisions on an individual basis, and I just want to make sure that people know that that's where the point where we are. So we do have to get the hospitalizations under control. The way you do that is to reduce the transmissions, especially the transmissions among the vulnerable population, because those are the individuals much more likely to need hospitalization if they actually contract the disease. And we should always remember that people don't stop having strokes and heart attacks and automobile accidents just because we're in a pandemic. And so we have to preserve capacity for all of those individuals as well. I know it's been a long and difficult year. Everybody would certainly love to be able to give hugs and kisses and handshakes and visit our most vulnerable without restrictions. It just isn't possible yet. But there really is light at the end of the tunnel. And my message to the people of Louisiana today is that we have to double down on the things that we know work so that we can get past this pandemic and return more to normal. And between now and then, especially over the next few months, it's going to be critically important that people embrace these mitigation measures, masking when you're around folks who are not part of your immediate household, physical distancing of at least 6 feet when around those individuals as well, staying home when you are sick, washing your hands frequently, and certainly making sure we're protecting the most vulnerable. That's just the reality of where we are as a state and as a country right now. And with that, I'm going to yield the floor now to Admiral Brett Giroir. I would ask that after his remarks that you ask him whatever questions you might have. And of course, if you've got a question for him after I come back up, I'm sure he would be willing to take that as well. But I'll come back on the backside of his presentation and conclude, and then I'll take your questions as well. Admiral Giroir.
So thank you, Governor, and I really appreciate the opportunity to come back to Louisiana. It's been a tremendous day. Many of the docs on the task force, we try to get on the road, visit states, and I'm sort of taking Louisiana, Texas, and up the center of the country. And of course, I'm very biased to come back to my my home state. Grew up on the West Bank and was able to visit a testing site today in Jefferson Parish before coming up here. I think you earned an honorary medical degree from that. It seems like you got all the facts really well. I really do appreciate Louisiana because since early March, we have been working together in very close collaboration. And I do mean this honestly. The health officials and, of course, the governor have not only been great partners, but been among the leaders in the country that we've been able to do new things, pioneer new testing capabilities. We're even doing some now with some new testing technologies. So we really value the partnership. You learn from us, we learn from you, and that's how we move the ball forward. I want to do 3 quick topics today. Number 1, the vaccine. Number 2, the importance of the mitigation steps. And number 3, just comment on some new CDC guidelines that came out today that I want to make sure you're clear about. First, on the vaccines. This is very, very good news. We have 2 vaccines that appear to be over 90% effective. They appear to be very safe, and they are nearly 100% effective at preventing severe COVID disease. This is more than we could have hoped for, but exactly what we did hope for because the technology has matured in a way that we thought this would work this way. It also seems that these vaccines work across the age spectrum. So it's not just the young, but they do work in the elderly, which is critically important because they're our highest risk groups. The first vaccine, Pfizer, will go through the advisory committee on December 10th. Moderna will go approximately a week later. They could be authorized very shortly after that. The very good news is we expect about 20 million Americans to be vaccinated within this calendar year or sometime closely thereafter. Now, that's not 200 million or 300 million. The ACIP recommendations yesterday, which is highly aligned with the governor's preliminary plan, is to vaccinate those who are most vulnerable, those in long-term care facilities. They die with the highest chance, well over 13, 14, 15% if they get it, but they also populate and can overwhelm the hospitals along with healthcare workers. And when I mean healthcare workers, I just don't mean the docs, but I mean the people who make the hospitals and everything work. You need the cleaning individuals to keep the places sterile. You need the maintenance staff, et cetera. So those will be in the first areas. We will have more and more people getting vaccinated. As we've stated, it may be May or June by the time most Americans are able to get vaccinated, but this is extremely good news, and the light is at the end of the tunnel, and it's a very bright, positive light. Hopefully by February and March, the weather starts getting warmer in some of the southern states. We have tens of millions of people vaccinated. We could start really knocking the edge off the pandemic, but you've got to keep doing what you're doing now, which is point two. Point two is I want to urge everyone in Louisiana that you are taking the right steps right now because we are at a very dangerous and critical point in the pandemic. Louisiana over the past few weeks has been pretty good. There have been 36 states in worse shape than you are that have been in red or orange zones, but you, like the rest of the country, is seeing an increase in cases, a dangerous increase in hospitalizations that has the potential to overwhelm the hospital system, and an increase in mortality. I think everyone saw yesterday that we had over 2,400 deaths in the country. Some of that's from delayed reporting over Thanksgiving, but that is a real increase. We know how to stop this. You don't need to shut down your economy. You don't need to have draconian measures, but you do need to do this. You need to wear a mask when you're in public and can't physically distance. This protects other people from you, but it also provides you some protection against other people. It's a critically important step. Secondly, avoid indoor crowded spaces. As I said before, I'm from the West Bank. I love bars and restaurants as much as anyone. But in these critical times, we know that indoor bars and indoor restaurants, if they are crowded, can be one of the major areas that the virus can spread. Now, that doesn't mean if you have a house party with 100 people, it won't spread there. It will. But turning down those knobs are very important, and it doesn't have to be yes or no. It's a dimmer switch, and from what I'm seeing, you're doing that dimming right now based on what the epidemiology is in your area. You've got to wash your hands, and testing is very important. As the governor has said, these card-based Binax tests, we've sent about 575,000 to the governor, who's had a great distribution mechanism according to the needs around the state. We've also sent about another 400,000 to nursing homes, assisted livings, and historically black colleges and universities directly in the state. So we're really surging those tests to the state right now to help detect those early spreaders. And remember, 50, 60, 70, 80% of people can be asymptomatic, still have the virus, and still spread it. The third point I want to make is about the CDC guidelines that have been a while in the making. This is very good news, and we've all been looking at these for a long time to make sure it's okay. Right now, if you are in close contact with a person, 15 minutes without a face mask within 6 feet, you are a close contact. If you're an essential worker, the recommendations are put a mask on, watch your symptoms, but you can go back to work. For everyone else, it's been a quarantine of 14 days. The data now show that a quarantine of 10 days is essentially the same as a 14-day. In fact, there's only about a 1% chance of someone coming after 10 days that might have been saved by a 14-day quarantine. Secondly, a 7-day quarantine, if you test negative at about 5 days, is the same thing as a 10-day quarantine without a test or a 14-day quarantine that we had before. Still, the CDC says if you have the luxury of quarantining for 14 days, that's fine, but I'm saying 10 days with a 1% risk is well worth taking, and most people are going to comply with a 10-day or 7-day much more than a 14-day. So this is really very good news. We would have liked to do it earlier, but you want to be sure about these things. You can't rush these. This is an important recommendation. So even though we're surging with the number of cases, we do feel it is absolutely safe for that 10-day quarantine or 7-day with the test. This helps people get back to school, back to work, back to doing the things that they need to do on a daily basis. So again, I thank you for being here, and I think if the governor is okay, I'm happy to take questions at this point. The lights are bright, so if I don't see you, I see you, sir.
Admiral, how many doses of the vaccine will Louisiana specifically get in December?
So I think that's being worked specifically with the governor now. The first tranche of vaccines is going to be about 6.5 million from Pfizer. That's going to be distributed roughly on a population basis. I don't know if that's been, I don't believe that's been publicly disclosed, but it's being working with the governor. Maybe you might want to expound on that. But again, 6.5 million divided by the population is not very much. It's a great start. It's going to be in the tens of thousands, I would imagine, but it's a great start, and we'll sequentially go after that. These are coming off batch to batch in the 3 to 5 million per week, assuming we have 2 vaccine manufacturers, and they'll just continually be rolled out like that. Yes, sir.
So do nursing homes and hospitals have to apply for the vaccine, or will the government, how will the distribution process work?
So the distribution process, we make recommendations at the federal level. The ACIP, which is the Advisory Committee on Immunization Practices, makes recommendations to the CDC director. The CDC director has accepted those recommendations. Those are transmitted to the governor. The governor has the decision about how vaccines will be distributed in the state. There's been micro-planning down to the nursing home, the hospital, how the distribution mechanisms go, but the governors ultimately have that responsibility. I do believe, and as has been said before, that Governor Edwards is entirely in line with the first tranche of vaccines being healthcare workers in long-term care facilities, and I think there's going to be almost unanimous approval or agreement with that. Once you get to the next level, I just want to prepare you all, there's going to be a lot of controversy because it depends on what you're trying to do. There are good arguments for essential workers and first responders, but if your hospitals are almost full or overwhelmed, there's going to be a larger argument for immunizing the people who would be in the hospitals. So the non-resident nursing home elderly, those people who have comorbid conditions like obesity, hypertension, diabetes. So it's going to depend much more on where the state is at that point in time. But I think with the first tranche of vaccines, you're going to see across the country near universal agreement with that. And I'm told by Governor Edwards that that is highly aligned with his plan and the state's plan. Yes, sir. Yes, so we've been very clear that we are expediting things as much as possible, but not more than possible. And I think it's very important for the American people, for people in Louisiana to know that tens of thousands of individuals have received these vaccines. There's been follow-up both for efficacy and as for safety. It's not just, the numbers, does it work, but how well the manufacturing is, right? Because we want to know that the person who gets the vaccine today, they're going to get that same exact vaccine because of precise manufacturing practices 6 months from now. And the FDA is doing this in a historically fast timeline. December 10th will be the advisory committee meeting. The people on the advisory committee have already gotten documentation because these are independent people to go through this. The FDA could authorize the vaccine within 24 hours after the advisory committee, or it could take a longer period of time. I can't tell you that because it really depends on the FDA and what the data say and what the advisory committee says. But I can assure you that when the vaccine is authorized and Moderna will probably be a week later, that the American people can be confident in its safety and efficacy. And I tell you, when it's my turn in line, I will certainly be there. Dr. Fauci will be there before me because he's almost 80, and I'm not. But we have every confidence this is a highly safe and an effective vaccine from what we know, but all the data will be disclosed next week. Ma'am?
Providing any sort of assistance to states, particularly with the Pfizer vaccine because of the cold conditions that are required? How are you ensuring that it's going to be stored correctly? And then how are you assuring that everybody will get that second shot? That seems to be a big concern.
Yes. There's going to be a very long sort of expository meeting where we go through step by step by step at the White House next week, that we have leaders at every area of the supply chain, from vaccines, the distributors, the people who are providing the vaccine, and governors who are making the decisions of who gets them. But that entire cold chain is extremely well worked out. The federal government will assure that the distribution will occur through very specific channels, that the cold chain is done. Every pack has syringes, has needles in 2 sizes for children or adults. All that has been worked out in great detail, down to what we call the micro-planning level, that with every single state there's micro-planning, depending on the governor's choice, but how that goes to nursing homes, hospitals, et cetera. Again, the first tranche is going to be relatively much easier because healthcare workers will be in healthcare institutions. They're sort of a captive audience, and people in long-term care facilities will be in long-term care facilities. And there's been a number of contracts let, like with retailers like Walgreens and CVS, to actually assist the governors, if they choose to actually go into all the nursing homes and provide those vaccines. So this has been worked out extremely well. I want you to have high confidence in that. Every aspect across the chain has been there. As we move further into the future, it gets a little more complex. We're planning for that, but people won't be institutionalized. They'll be elderly in the community or people with comorbid conditions. But that will be at the next phase. You asked a second question. I'm sorry, I forgot about it.
Is there going to be some sort of tracking system, or what is the federal government going to be recommending to states about the 2-shot?
Yeah, so there are tracking systems. So everybody, although there is significant protection with the first shot, it's vital that everybody gets the second shot, so you get the long-term protection and the best protection. And of course, you need to get the same vaccine. You can't get Pfizer one time and Moderna the second time. There are very sophisticated tracking mechanisms, as well as important incentives, financial incentives for those who are providing the vaccines to make sure they get the second vaccine into the same person. They'll be much more rewarded for the second vaccine than the first. So again, remember, it's not the same thing because of the cold chain, but we've already distributed 180 million flu vaccines this year. Distributing vaccines is something we do and do pretty well every year. The differences here are the selected populations, and as you pointed out, the cold chain, which is a challenge, but it's not like delivering this to sub-Saharan Africa. We know where every single freezer in the country is. We have all the dry ice done. It's going to be door-to-door service from places like FedEx and UPS. So we're very confident in this distribution mechanism to get to the people and have that cold chain done. And again, we're down to the micro-planning level. Where does each 100 vaccine doses go, and how do they get distributed? Many states will be using the National Guard. It's not for distribution, but to actually help people put needles in people's arms through PrEP Act coverage, which is something I gave guidance under the Secretary's broad authority. We're enabling all pharmacies, pharmacy techs, pharmacy interns to be able to give COVID vaccines to anybody 3 years and above. The National Guard will be taking place in many states. They have EMTs that are all part of the National Guards that vaccinate guardsmen. So that's sort of the last piece that the states really work on. There's lots of support for that. I want to make sure I get to other questions before I get to another. Anybody that I haven't seen, I can't see. Okay, yes, sir.
Going back to the second tranche, and you talked about this controversy. So Louisiana has kind of an outsized share of people with comorbid conditions. I'm wondering if that might delay the time frame under which people who, the general public
Yeah, I think you're getting, and I'm not trying to dodge you, I think you're just getting a little hypothetical because we're about 3 rows up the chain here. Certainly the first tranche has been described. It's going to be based on a population basis. We want to get through that. I think there can be discussion, depending on where the country is, about whether there's differential distribution based on comorbidity or not, and there are arguments for either way. Based on population, that's egalitarian. Nobody can argue with that. But certain states have many more elderly. Certain states have many more comorbid people. That will be a policy decision sort of at the highest level, like at the presidential and vice presidential level. But there are arguments for both of those, and I just think we need to get down the pike a little bit. We may have a 3rd or 4th vaccine approved by that time, in January. The Johnson & Johnson vaccine is a single-dose vaccine. That enters in the equation too. It's just a little theoretical right now. I think we've got to get through the next month or so and then address that. But your point is well taken. Louisiana has a very high comorbid population. That's an issue that we need to work on here. So many of your people will be at higher risk than other states, sort of on a general basis. But in terms of elderly population, you kind of balance that with some of the other states. I want to take all the time, but if any other questions, or I'll give this back to the governor. Okay, thank you.
Thank you. I'll tell you, we do a lot of telephone calls. We do a lot of video telephone conferences. It is great to have someone who is a principal member of the White House Coronavirus Task Force physically present, so that we can personally engage and ask questions and make sure that we are as advanced as we can be and being prepared for all of these things, whether it's testing or vaccines or anything else related to this pandemic. And so it's good to have Admiral Giroir here today. I want to talk a little bit about the vaccine. Not much to add. I just will tell you that governors have been getting weekly updates from the beginning about Operation Warp Speed. I have 100% confidence in the safety and efficacy of the vaccines as they're granted the emergency use authorizations by the FDA. And we will be as faithful as we can be to the recommendations that come from the Advisory Committee on Immunization Practices. ACIP met yesterday. They only looked at the first order of priority for the first vaccines that come out, being the hospital workers that he mentioned, and also residents and staff of nursing homes. Fully consistent with everything we had planned up to then, and so we are on track. I will tell you, Louisiana was one of the first states in the country to achieve a green status because of our preparedness for the COVID vaccine. Not to tell you we have it all figured out and that there won't be hiccups, but we've been working extremely hard every single day, the folks at the Department of Health and especially the Office of Public Health. With respect to the allocations, it's not possible to precisely answer how many doses we get out of the first shipment. I will tell you now what we know, and we're not trying to hide the ball from anybody, and I think within 2 weeks we're going to have a lot more information. But suffice it to say that for the month of December and probably the early part of January, we will be getting through the vaccinations of that first priority group, the hospital workers and the nursing home residents and staff. And so we do have some time to prepare for that next order of priority and how that's going to be done. Initially, we know that there's a pro rata allocation of the available doses coming to Louisiana. It'll be 1.46% of what is available. Now, that is our pro rata share among 64 jurisdictions. That's the 50 states plus some territories and so forth, but also there are some metropolitan areas that their own jurisdictions. And that is the pro rata share based on population above 18. So that's the way that's going to work. Right now, based on the overall number of Pfizer doses we think are going to be available in the first week, that's going to be in the neighborhood of 40,000 doses. We think the second week Pfizer will be around another 40,000 or so. And then you're going to start having the Moderna come in right behind that. And so we don't have a lot more. And it's not that the federal government is hiding the ball from us either, but we know how many doses to expect, but they have some federal priorities, whether it's the Department of Defense and other things. So we know the multiple is 1.46%, but we don't know exactly what it's going to be multiplied against, but that's what we will get. It will be Pfizer at first. That's the ultra-cold storage requirement vaccine. And we intend to administer those vaccines through our hospitals because they have the cold storage capacity. And then when the Moderna comes online, that's what you will see going to the nursing homes. So we're fairly confident in our plan, at least up through there. We will have much more information for you in a couple of weeks about what's going to happen after that. I did want to just mention, you all did not receive the weekly report that came from the White House Coronavirus Task Force. It came last night. You're going to get it in just a few minutes. I do hope you'll take a look at it. You will see that the White House Coronavirus Task Force kind of steps it up one level in terms of the language that they use and how dire the situation is becoming, both around the country, and certainly it continues to get worse here in Louisiana as well. But you'll have that in just a minute. We'll be sending that out to you. Before I take questions, yesterday was Giving Tuesday, and there are a lot of people in need right now, and I know that was yesterday, but the needs haven't gone away. So I'm going to continue to encourage the people of Louisiana to be generous and find ways to help. There are a couple of ways that I'm going to recommend to you. First of all, the need for blood donations is acute right now, and so I would ask that everybody who is eligible and can do it, give blood, especially those people who have recovered from COVID-19, and that recovery was at least, how many months ago for convalescent plasma? It's either 3 months. I think it's 3 months. But Dr. Kenner, you know, 3 months. If you've been recovered from COVID-19 for 3 months and you give blood, there's a very good chance that blood could be used for convalescent plasma transfusions. Incredibly important as we continue to fight this pandemic, and those transfusions are being administered regularly now, and so the demand has actually gotten up to the supply, and so if we don't get the supply up, we will have people who will needlessly stay in the hospital longer or potentially have a much worse outcome, including death. And so I do encourage people to give blood, but that's for everybody, but especially those who have recovered from COVID by at least 3 months. I would also remind everybody that food banks, in addition to blood banks, food banks are in desperate need of your support, with more people than ever facing food insecurity, and it's happening during the holiday season. So if you are able, please donate financially to an organization like Feeding Louisiana. All right, so with that, I'll take a few questions. Yes, sir.
Governor, Admiral Giroir and some others have raised the idea that we might not have enough staff nationwide to put vaccines in arms. You mentioned the National Guard. Can you talk about it more? Do you think we're going to have enough staff in Louisiana to meet the demand here?
Yes, we're going to make sure of it. And by the way, eventually people are going to get this vaccine if they're not in the highest priority groups, much like you get the flu vaccine. So you're going to go to the public health unit. You're going to go to your local pharmacist, whether it's an independent pharmacist or a chain pharmacy. You'll get it from your primary care physician or from a hospital. And so we're going to get to that point. The critical part is how do we administer those vaccines early on, especially once we get out of that first order priority. It is important that we have the National Guard available, and that's why we're talking about Title 32 reauthorization and extension, in addition to the work that the National Guard is doing on testing. But yeah, we're going to make sure that we have the folks to administer the vaccine, and that's. I mean, I'm not going to tell you that we don't have some concerns about that, but that's a big part of the work that we've been doing. Yes, sir.
Hey, Governor. So Tony Spell's injunction to the Supreme Court were recently rejected. I'm sure you know about that. Are there any other instances that you guys know about of other churches who may be less compliant with the COVID restrictions?
Yeah, well, you know, I'm not naive. There are thousands and thousands of churches out there. We would want all of them to be compliant with the restrictions and mitigation measures. Right now, in the state of Louisiana, if you exclude all of the essential infrastructure as designated by CISA, the Department of Homeland Security, the most favored venue by restriction relative to occupancy percentage happens to be our places of worship at 75%. Now, it's 75% or whatever they can do to achieve distancing of at least 6 feet between folks who are not part of the same immediate household, but no more than 75%. And then, as you know, the generally applicable percentage is 50%, and then it goes down to 25% for bars and so forth. I'm not aware of any specific houses of worship that are not in compliance, and I will tell you, I suspect the overwhelming majority are, because these are mitigation measures that are proven to be effective. They work, and quite frankly, given the dire situation that we're in the United States and here in Louisiana, it's not much of a burden. It's not terribly onerous. So I'm not familiar with any other churches that may be a problem right now. And in fact, I want to thank the churches, because I think the leadership of the faith-based community has been just tremendous overall, and really good examples being set by pastors and lay leaders all over the state. Yes, ma'am.
Issues that the state may have in terms of getting people vaccinated is the lack of comfort with the vaccine and the lack of trust in its efficacy. So is there a part of the state's plan that involves specific marketing, or how are y'all going to deal with that, and what are y'all specifically going to try to do to make people feel more comfortable with the idea?
Well, that is a great question, because the vaccine doesn't save anybody. Vaccinations, which means you have to have people who show up and receive the vaccine. And so your question, I think, is spot on. But this is not just an issue for Louisiana, it's an issue for the whole country. That was a big part of the conversation we had Monday with the White House Coronavirus Task Force, General Perna and the Vice President, Secretary Azar, and others talking about the vaccine and how we make sure that we communicate. I mean, I have every confidence that it's safe and effective. But that confidence that I have doesn't immediately translate to somebody else, and we understand that. And so there will be public relations campaigns. There's going to be a lot of transparency. You know, some of this has to do, quite frankly, with how quickly it was developed. Thank God it was quickly developed. I mean, people are dying. Well over 6,000 here in Louisiana thus far. But not a single step that is required to ensure the safety of this vaccine has been skipped. And what they did, and quite frankly, the task force, the president, the vice president, everybody deserves tremendous credit for this, is they took a lot of steps that would typically happen sequentially, one after the other, and they did as many of those as they possibly could at the same time. But they didn't skip steps. And the trials, I mean, 30,000 individuals in the trials, that they got more information faster than they would normally get them. And then the taxpayers of the United States underwrote the expense of the mass production of these vaccines while they were still being produced, which is something that the private sector wouldn't do on its own. So that if it gets that emergency use authorization from the FDA, and we think Pfizer will, and soon after that Moderna, then they don't have to start producing the vaccine. They will already have vaccine that's been produced and is ready to be distributed. So the process has really been remarkable, and I don't think safety has ever been put on the back burner. You know better than I. So the safety and the efficacy are going to be there. And by the way, efficacy. It is very unusual to have a vaccine that is 94, 95% effective. And the most recent data from Moderna shows that it's 100% effective at preventing serious cases of COVID. So how do you then get people to have confidence in that? You make sure that they hear over and over what I just said. They need to know that it's been tested in people who look like them. and it's been found to be effective and safe. And then you have to have people who look like them spreading that message as well. And so there's a lot that's going to go into this, but quite frankly, you all in this room play a big part in this. What you put in your editorial pages, how you cover this topic is going to make a big difference in how people see this issue and their receptivity to the vaccine. But we don't want to achieve herd immunity 2 years from now because people got COVID. We want to get there much sooner because people got the vaccine. And when that happens, and when enough people get it, then the virus just can't spread like it has been doing since March here in Louisiana. Yes, sir.
Governor, among the congregate settings that have had problems with coronavirus are state prisons. Where do they fit in? When are prisoners going to get the vaccine in Louisiana?
Yeah, well, we haven't gotten to that step yet, and I will tell you, just like other congregant settings and non-congregant settings, we certainly have had our cases in our prisons. One of the things that and you know, you got to choose your language here very carefully. We've got tens of thousands of prisoners in Louisiana. Anytime you have community spread, you're going to have the disease that comes into the prison, and once it gets there, it's going to spread because these people live in close proximity to one another 24 hours a day. But of those tens of thousands of people in prison, we've had 31 deaths from COVID. And that's 31 more than we would want. And what I'm talking about among inmates, because I think we're at 5 or 6 with corrections staff as well. But 31 inmates, and so we're working extremely hard, and testing is a big part of what they do as well. The vaccine, we're working through that. I cannot give you the sequence, the priority of every particular group in Louisiana all the way through the end of when we wrap up vaccinations. I just can't give it to you today. But I can tell you we're working on that, and to the maximum degree possible, what we do in Louisiana will reflect what those recommendations are coming out of ACIP. Yes, sir.
Governor, I'm sure you know a photo is circulating online of you from a country club in Baton Rouge from early November, where in that moment you weren't really wearing a mask or social distancing. Do you have any response to that?
Well, sure. First of all, there was absolutely nothing that I did that day that violated the rules that were in place in the phase 3, which is when that actually happened, or today's rules. If you'll see, I was outdoors at a table. I don't know exactly. It looked to me like I was getting up to leave. Had that photo been taken 10 seconds later, you would have seen me with a mask on until the time I got in the car, and actually till the time I got back to my residence. So, I mean, I don't think we ask anybody to eat at a table with a mask on. But you'll see that I'm outdoors and violated absolutely none of the mitigation measures that we have in place. Yes, sir.
Governor, specifically talking about that first batch of people getting the vaccine, healthcare workers and long-term care facility residents, as far as nursing homes go, what is the process for Louisiana? Are the first nursing homes to get it going to be in higher populated areas or parishes with higher percent positivity? Has there been an application process? What's kind of that look like for nursing homes specifically?
Almost all of the nursing homes in Louisiana have elected to contract with either CVS or Walgreens, who will administer the vaccine in those nursing homes. And that is something that has been orchestrated out of Washington, and it's going to be very, very helpful because all of these residents, in fact, for both of these vaccines, if it's Pfizer, you got to get that second shot within 21 days and 28 days for Moderna, which I believe the Moderna vaccine is going to be the one that we're going to be administering in the nursing homes because it doesn't require that cold storage, ultra cold storage, I should say. And so they will be contracting directly for the most part, and I hope that by the time we get there that all nursing homes are doing this. And then for weeks now, Walgreens and CVS have been working on their plan, both with respect to the distribution, the data keeping and sharing, and having the individuals on hand to go in and administer those vaccinations. But we're talking every day with hospitals, we're talking with nursing homes to make sure that we are ready to do this. And I quite frankly feel very, very confident about our state's ability to work with our federal partners to start vaccinations as soon as we receive the vaccines in accordance with that first order of priority, priority 1A. We're now going to set our sights on what comes next and how we do those things. And again, that won't happen until sometime in January, and it's my expectation that in a couple of weeks we're going to have a lot more information for you. And we submit our plan for vaccinations. We've done preliminary work. We submit our plan on Friday, correct, Dr. Cantor? So I wouldn't want to tell you something today that actually where we change our mind in the plan that we submit on Friday anyway. But we're going to come back in a couple of weeks, and we're going to have plenty of information for you around the vaccine. Look, thank you for continuing to cover all of these important matters. It really is important to the safety, to the health of the people of Louisiana. And I want to thank the people of Louisiana. I know it's tough. I know people are tired of this pandemic. There really is light at the end of the tunnel. And while the vaccine is good news, we can't focus so much on that we lose focus on the things that we have to do in order to stay safe, reduce transmissions, reduce hospitalizations and deaths. And so I'm going to ask people to continue to make sure that when you are out and about and that you're wearing your mask, when you can't physically distance, that you do physically distance at least 6 feet from people who are not part of your immediate household. You stay home when you're sick, wash your hands frequently, protect the vulnerable. And for those of you who haven't done it yet, it's not too late to get your flu shot. We don't want to have folks come into the hospital with the flu because that also erodes the capacity that we have to deal with COVID and non-COVID patients as well. So thank you all very much. We will see you again next week, and I think it's a week from Okay, a week from Thursday. If we need to call a press conference between now and then, we will certainly let you know. Thank you, and the last word is to be another word of thanks and appreciation for Admiral Giroir, and welcome home to Louisiana. Come home anytime, especially when you bring tests. God bless. Thank you all.